Hello everyone, I am Dr. Meghana Gowda from SDM College of Naturopathy and Yogic Sciences, working as Assistant Professor and Medical Officer from Department of Pathology. Today we will be studying about pathological calcification. This is one of the important topic which is asked several times for 5 marks, as well as it is a repeated question which can be asked separately. Its types can be asked separately for 5 marks. That is, dystrophic calcification can be asked for 5 marks and metastatic calcification can be asked for 5 marks. So today we will be learning about this. What is pathological calcification? So in normal body, as you all know, there is deposition or the presence of calcium in the bone as well as teeth, and nowhere else in the normal body you will see the deposition of calcium or the presence of calcium. But in case of pathological calcification, in case of diseased tissue or in case of a person who is deceased, okay, you will see this abnormal deposition of calcium salts in the tissue. Okay. So in normal individuals or a healthy individual, you will never see this pathological calcification. But once the person is deceased, or in case if there is an injury or cell damage, this is when you will see the pathological calcification. So pathological calcification, the abnormal deposition of calcium salts in the tissue, is often associated with injury or cell damage. So whenever there is any abnormality in the body in the form of disease or a injury, this is when you will see the pathological calcification in the abnormal tissues of the body. So we will see about the definition of pathological calcification. Deposition of calcium salts in the tissue other than osteoid or enamel is called as pathological or heterotrophic calcification. So here the definition refers or specifies that other than the osteoid or enamel, so other than the bone or the teeth, there is abnormal deposition of calcium salts in the tissue, which is abnormal. In the normal body, you will see the presence of calcium in the bone as well as in the teeth. But here, there is deposition of calcium salts in the tissue other than the osteoid or the enamel. Next, there are two types of pathological calcification, that is dystrophic calcification and metastatic calcification. And the etiology and pathogenesis of the two are different. It is not the same. So, but the morphological feature that you see is similar. When you go for the microscopic examination or the gross examination, it will give us similar features, whereas there is difference in the etiology as well as pathogenesis, or the occurrence of both is different. First we will see about the definition of dystrophic calcification. Deposition of calcium salts in the dead or degenerated tissue with normal calcium metabolism and normal serum calcium levels. So here it says that there is deposition of calcium salts in the dead or degenerated tissue. So this refers to as injury or cell damage in case of diseases, which is unusual. Okay. So, but the normal calcium metabolism and normal serum levels are normal. Okay, there is no defect in the normal calcium metabolism or the normal serum levels, but there is deposition of calcium salts in the dead or degenerated tissue. Next, what is metastatic calcification? Occurs in the normal tissue and is associated with deranged calcium metabolism and hypercalcemia. So here you can see that there is deposition of the calcium salt in the normal tissue, which is opposite to the dystrophic calcification, where you can see the deposition of calcium salt in the dead tissue and degenerated tissue in case of dystrophic, whereas here there is deposition of calcium salts in the normal tissue, but there is derangement in the calcium metabolism and hypercalcemia. Hypercalcemia refers to increased serum calcium levels, which is abnormal, and it can be also referred to as a abnormal diseased condition of body. This is called as metastatic calcification. Next, we will see about the general histological features of pathological calcification. Calcium salts appears as deeply basophilic. Here, basophilic refers to the basic staining property of the content or the calcium salt. So, you can see in the picture, there is bluish, blue purplish discoloration or the presence of salt in the histology. Usually, it appears as irregular and granular clumps. The deposit may be intracellular, extracellular, or at both the locations. So, there is deposition of calcium salts either inside the cells or outside the cells. In both the location, you may also see it. Occasionally, ossification may occur. Ossification is nothing but formation of new bone or the formation of bone. Okay. So occasionally you can also see the ossification, which is unusual. Etiopathogenesis, the two types of pathological calcification results from distinctly different etiologies and mechanisms. So as we all have referred in the previous slides, so it says that the etiology and pathogenesis of both the calcifications are different. It is not the same. Dystrophic calcification occurs due to two types of causes, that is calcification in the dead tissue and calcification of degenerated tissue. So let's look upon some of the examples for both the types. So calcification in the dead tissue, caseous necrosis in tuberculosis is the most common site for dystrophic calcification. So you can see in the picture there is yellowish circular granular like substance that you can see in the picture, which is the caseous necrosis. Along with that, you can see there is deposition of calcium salt. Then there is liquefaction necrosis in chronic abscess, where you can see the calcification as marked in the picture. Fat necrosis following acute pancreatitis or traumatic fat necrosis in the breast. Then Gamma-Gandhi borders in chronic venous congestion of spleen. These are also the examples. Infraction may sometimes undergo dystrophic calcification. Thrombi, especially in the veins, may produce phleboliths. So phleboliths is nothing but the formation of calcium salts in the veins. Then hematomas, that is, you can also call it as bruise, in the vicinity of the bone may undergo dystrophic calcification. Then in case of parasitic infections, calcification in case of breast cancers and congenital toxoplasmosis. So these are the parasitic infection that may also result in the destruction of the tissue, leading to deposition of calcium salt. Then calcification in degenerated tissue. So the examples are dense old scars, atheromas in the aorta and coronaries, that is deposition of cholesterol in the vessels. Then Monkenberg's sclerosis, then stoma of the tumors such as uterine fibroids, breast cancer, thyroid adenoma and goiter. These are few of the examples for degenerated tissue dystrophic calcification. And tumors such as meningioma, papillary serous cystadenocarcinoma of the ovary, then papillary carcinoma of the thyroid, then cyst which has been present for a longer time, example epidermal and pilar cyst, okay, are the examples for degenerated dystrophic calcification. You can see in the picture clearly the presence of dystrophic calcification. Then calcinosis cutis, deposition of calcium salt in the tissue, in the skin and subcutaneous tissue. Then senile destructive changes such as in the costal cartilages, tracheal or bronchial cartilages and pineal gland in the brain. Next we will look upon the pathogenesis of dystrophic calcification. So there is denatured protein in the necrotic or degenerated tissue bind phosphate ion. So usually once there is a cell destruction, that is when there is release of certain phosphate ions that reacts with the calcium ions which are freely available, that results in formation of precipitate of calcium phosphate. So the phosphate ion combines with the calcium ion resulting in calcium phosphate. So the initiation phase, here the precipitate of calcium phosphate accumulate intracellularly in the mitochondria or extracellularly in the membrane bound vesicles. Propagation phase, minerals deposits in the initial phase and propagate to form the mineral crystal. So this is a simple mechanism of how a pathological calcification occurs in case of dystrophic calcification. Next we will see about metastatic calcification occurs in normal tissue due to hypercalcemia. So there is increased serum calcium levels in the blood that results in increased or the abnormal deposition of calcium salts in the normal tissue caused by one of the two conditions, that is excessive mobilization of calcium from the bone and excessive absorption of calcium from the gut, which plays a major role to say that a person is deceased or is in an abnormal state. Excessive mobilization of calcium from the bone, more common and includes the following, that is hyperparathyroidism. Those includes parathyroid adenomas, then parathyroid hyperplasia and chronic renal failure. Then bone destructive lesions, multiple myeloma and metastatic carcinoma. Prolonged immobilization of patient results in disuse atrophy of the bone and hypercalcemia. So this all results in two of the mechanism induced metastatic calcification, either due to excess mobilization of calcium from the bone or excessive absorption of calcium from the gut. Then excessive absorption of calcium from the gut, that is hypervitaminosis D. Then hypercalcemia of infancy, that is metastatic calcification may occur. Then milky alkali syndrome caused by excessive oral intake of calcium in the form of milk and calcium carbonate in the treatment of peptic ulcer. So, there is increased availability of calcium that results in increased absorption of calcium from the gut. Then site of metastatic calcification. So, which and all are the areas where you can see the deposition of calcium salts. So, may occur in any normal tissue of the body, but more commonly kidney, basement membrane of tubular epithelium and tubular lumina causing nephrocalcinosis, lungs, alveolar walls, stomach, acid secreting fundal glands, blood vessels, internal elastic lamina, then cornea. Then pathogenesis of metastatic calcification, excessive binding of inorganic phosphate ions with the calcium ions. This is elevated due to underlying metabolic degeneration. This causes formation of precipitate of calcium phosphate at the sites. Thank you.